flowing back to the kidneys. When urine starts flowing back to the kidneys, you just discover that the kidneys will start going into what you call failure. And kidney failure is not something you joke with. Once your kidney fails, you are in a very big problem. The issue of kidney transplant and all the rest of them is not what a lot of people can afford. So prevention is still better than talking about taking care of the complications that come with an enlarged prostate that is left without doing. Of course, usually when the prostate starts getting enlarged and men starts having symptoms, of course, there are drugs that we do. There are conventional drugs, internationally approved drugs that we surgeons usually give patients. We urologists, we are urologic surgeons, the people that take care of the prostate. We give these drugs so that the essence of these drugs is to relax the prostate so that urine can start flowing out efficiently. But as time goes on, in some patients, you discover that these enlargements now gets to the point that it's no longer, the drugs are no longer sufficient. The drugs are no longer working, even for patients that are actually on these drugs. And that is where we now start talking about removal. And then, when you talk about the issue of removal of the prostate, of course, a lot of people are afraid of the issues of open surgery. Open surgery, to do this, to do that, to do that. So technology is steadily advancing. And of course, transurethral resection of the prostate came in, which helps for removal of the enlarged prostate, usually between the less than 100 grams prostate. For these very big prostates, these other technologies now, like the tooth flap you are talking about, can help with complete removal of the very big prostate, so that a man will not depend on catheter. I've seen men that will come, how are you? How long have you been on catheter? I've been on catheter for 15 years. That's